Hi, my name's Muhayman Sadiq, and I'm a diagnostic radiology incoming resident at UT Health Houston in July of 2026. And today I'm going to be doing a blog for the Academy of Online Radiology Education. And today, my blog is going to be focused on artificial intelligence applications in bone scintigraphy and talking a little bit more about where we are today. And I'd like to thank Dr. Ghazi and Dr. El-Sayas for all of their continued support and the opportunity to get involved with ACORE and to be able to give blogs like these. So my article title is From Image to Index, Diagnostic Accuracy of a Novel Semi-Quantitative Approach for Assessing Suspected Periprosthetic Joint Infections with Triple Bone Phase Scintigraphy. And for some background, total hip and knee arthroplasties are commonly performed in those with end-stage osteoarthritis who do not respond to conservative management, and despite their success, they can lead to complications including aseptic loosening and periprosthetic joint infection, which is a major cause of persistent pain following arthroplasty and presents a significant diagnostic challenge, particularly when clinical or imaging-based findings are inconclusive. And triple-phase bone scintigraphy is a widely used nuclear medicine technique with high sensitivity and minimal interference from metallic artifacts, making it ideal for prosthetic evaluation. However, a traditional interpretation of triple-phase bone scintigraphy relies on qualitative visual assessment, which is subject to inter-observer variability. And to improve diagnostic objectivity and reproducibility, this study introduced a semi-quantitative index known as the Blood Pool to Delayed Ratio Variation Index, or BPrDr Variation Index. I think it's always useful to talk about the previous literature to see what it tells us, and a 2024 study published in Scientific Reports developed a machine learning technique combining a mobile VIT and a growth optimizer enhanced by the arithmetic optimization algorithm to analyze bone scintigraphy images. And the authors, by doing this, aim to improve early detection of bone mets by using automatic feature extraction and selection, and their approach used 2,800 real-world bone scan images to train and validate the system, and impressively produced an area under the curve of around 92% for erosions, which outperformed other feature selection models in classification accuracy on multiple datasets. And the integration of the mobile VIT enabled capturing both local textures and global patterns in bone scans, and this approach demonstrated promising potential to improve diagnostic consistency and efficiency. Another 2024 multi-center study evaluated 10 different convolutional neural network models for analyzing whole body bone scintigraphy and compared AI performance against the performance of 3 board-certified nuclear medicine physicians in 2 tasks, the first being classifying scans as either normal or abnormal, and the second being differentiating malignant from non-neoplastic bone disease. And for the first of these 2 categories, DenseNet 121 with attention-augmented aggregation achieved the highest performance with the stats that you can see over there. And for distinguishing malignant from non-neoplastic disease, Inception ResNet V2 with spatial pyramid pooling performed the best, with similar stats to the DenseNet as far as area under the curve and accuracy go, but at the cost of a lower sensitivity but a much higher specificity than that of the DenseNet 121. And AI models on the whole demonstrated significantly higher or comparable performance to human readers while reducing interpretation time drastically. One of the final studies published in Scientific Reports in 2020 trained a deep neural network on over 12,000 bone scintigraphy scans to detect bone metastases in cancer patients, and this model was tested against experienced nuclear medicine physicians and assessed across different cancer types, and the AI system produced outstanding performance and areas under the curve for breast cancer, prostate cancer, and lung cancer, 3 of the most common cancers that we see here in the United States, as well as impressive performance for other types of cancer as well. And interestingly, in a head-to-head evaluation on 400 cases, the AI model actually outperformed human physicians in accuracy and sensitivity, whilst only taking just over 10 seconds to interpret all cases. And consulting the AI model in turn improved physicians' performance, reducing false negatives and increasing overall diagnostic confidence. Which leads us back to the initial study that we were discussing, and in that study, 17 patients had periprosthetic joint infections and 47 were diagnosed with aseptic loosening, and the mean BPrDr variation index was significantly higher in those with infected prostheses compared to those with aseptic cases, with a significant p-value and a large effect size, and the ROC analysis demonstrated an area under the curve of 0.71, indicating moderate discriminative ability. And the optimal threshold for differentiating infection from aseptic loosening was 14.73%, and at this cutoff, the BPrDr index achieved a sensitivity of over 88% and a negative predictive value of just under 93%, and the specificity at this rate was moderate at around 55%, and the positive predictive value just under 42%. And the decision curve analysis supported the potential clinical utility of the index by demonstrating a net benefit across a range of threshold probabilities. And on the whole, this paper and previous literature introduced straightforward methods to increase objectivity in interpreting bone scintigraphy for prosthetic infections, and the BPrDr variation index is easy to calculate with standard equipment and has the potential to reduce potential diagnostic uncertainty in otherwise challenging cases. And however, nevertheless, the study's retrospective design and relatively small sample size highlight the need for further prospective validation in larger and more diverse cohorts. And given the modest specificity, a positive BPrDr index should still prompt confirmatory imaging, which should be interpreted by a board-certified nuclear medicine physician. And some of those imaging modalities which can be used are things such as labeled leukocyte scintigraphy or FDG PET-CT before proceeding to invasive procedures or advanced management plans. Even so, the method holds promise as a practical screening approach, particularly in resource-limited areas where access to advanced imaging may be constrained. Thank you so much for listening to my blog today.